My name is Mpumelelo Magnificent Mtolo.
My name is Ruth Pandoi from an area of Harding.
My name is Maureen Kusi from KwaZulu-Natal, Margate.
The diagnosis took place when I visited my grandfather during the December holidays. And when I got there, I started having TB symptoms. My grandmother noticed that I wasn't alright, I wasn't my normal self. So she advised me to visit a nearby clinic. And when I went there, they asked for my speed times. I gave them my speed times, and then I waited for I think it was a period of 1 week. After that, they called me back for my result, and then they told me that I have TB. And then from there, I started taking my treatment. So that is when I was diagnosed with TB. And then from there, I carried on taking the treatment. And then when I was taking the treatment, there were errors when the nurses gave me the medication. When they were supposed to give me medication for the whole month, they will give me medication which lasted me for only 2 months, for only 2 weeks. I mean, so after the 2 weeks, I had to go back to the clinic again and ask for more medication to last me the whole month, and so that costed me a lot of money, and money that I couldn't afford because then I still went to school. And so I asked the nurses to give me a transfer letter because I was about to go back to Potchefstroom in Manchester, where I live currently, because my whole life is back there. And so even getting a transfer letter was kind of a huge problem, because when I spoke to the nurses, they kept directing me to other people until it came to a stage where I had to leave because the schools were reopening and I didn't have the transfer letter. So from there, I defaulted because I felt that I was back to my normal self, because I thought everything was just back to normal. So I went back to Manchester, I went back to school, and thought everything was alright. And then I think after 1 month's time, and then I started having the very same symptoms again. I felt weak, I lost weight, I didn't finish most of my meals. So again, my mother advised me to go in a clinic in Manchester, which is Gwambunde Clinic. In that clinic, they also took my speed times. I waited for a period of a week. It was a Wednesday. I gave them my speed times. I came back on the following Wednesday. They gave me the they told me that I have TB, and then I'm going to start taking medication. So as I told them that I had defaulted before, they told me that they will put me on treatment and also an injection for the ordinary TB. So I took the treatment, and when I was about, I think I was on my 37th injection, and then they called me into the clinic again, where they gave me a letter and told me that I should go to Manchester Hospital as soon as possible and see the doctor there. And so because Manchester Hospital, it was a short distance from the clinic to Manchester, I walked to the hospital as soon as possible. And there I met with Sister Kaya, who admitted me there. And so she gave me all the details that I've been diagnosed with MDR. I mean, she gave me counseling that I'll be there for a minimum of 2 months. I'm going to start taking medication and injections right away. So that is how I was diagnosed with the MDRs.
I had TB in 2008. I took the full course. It was malaria TB, so they put me on a course for 9 months. I finished that course, and I was fine. I was declared cured. I was diagnosed at my workplace. I'm a student nurse at Potchefstroom Hospital, and I went to the occupational health clinic because I was feeling a funny bubbling sound that was on my chest. By then I was feeling normal. I wasn't coughing. They had no symptoms of TB. Then they took specimens for sputum, for culture and sensitivity, and when those came back, then I was confirmed that I had MDR. By then, when they came, it was probably 4 weeks. I was already now coughing really bad. So when they told me, I was overwhelmed. I was just afraid of the whole diagnosis because I knew that the treatment was very intensive. And my first reaction was, am I going to manage the side effects and everything? and then I went to start the treatment. I was told about that my admission's going to be for 2 months, and that made me even more afraid because I was going to lose out on some studying time. I also informed my family, and although they were supportive, but they didn't allow me to go home because they were scared of me infecting them. My friends were supportive, and also at school they were very supportive of that I'm sick and I need sick leave.
It was at the beginning of 2013 when I noticed that I had some pain in the hip joint between the hip and the right leg. So I had a bit of a limp whenever I was walking. The pain was not that strong at the time, but it became stronger as the time went by. So I went to the general practitioner in town. So the doctor said I must just go for an x-ray. So he booked me for an x-ray, and I went to the x-ray. The results came back and there was nothing wrong with my joint. The problem continued. It complicated and until to the point where my right leg locked completely. So that is when I started to realize that there was a problem, a serious problem. Then I went to another doctor now for a different opinion. Then he booked me for an MRI scan. The test was done there, and they discovered that I had an abscess on my right leg inside. Then I went for theater. They booked me for theater. I was operated and had 2 drains. I was operated both sides, on the left and the right, and I had drains in me. Then I was taken to ICU for like 2 days. Then they took the fluid to test if there was anything that was maybe TB, the possibility of TB, because that's what they told me, that the way it looks, it could only be TB. So they took that fluid that was drained out from the abscess for culture, and then it was tested. But meanwhile, before the results came back, I was given they called it what, REFA 4, if I'm not mistaken, the normal TB treatment. Then that was when the whole thing started. That was when I started to feel sick, because all the time I was not sick, I was just limping. It made me very, very sick. I lost a lot of weight. I was losing weight. I was not eating properly. I was vomiting all the time, and I lost a lot of weight, up to about 32 kilograms. So at that time I was having these operations, the 2 operations that I had. So it happened that the one on the right, where the abscess was, it became septic. So it started to ooze. It was oozing, and I was taken back to hospital. 2 days after I was discharged for the septic wound, I was called back to hospital for the results. They told me that I had a resistance to the medication. That is why I was so sick after taking this normal TB treatment. They explained everything for me, that now that I have this kind of TB, I'll have to be hospitalized for the minimum of like 2 months, and I'm going to have to take injections on daily basis for like 6 months, all the facts, and take medication for 24 months. That alone was too much for me. I was diagnosed with cardiac failure, congestive cardiac failure. So I was already having the chronic medication that I had to take. Then also I had to come to terms with this too much TB treatment that I had to take. So for me, it was a very, very difficult situation, and having to make my colleagues understand that now this is the situation they have to face, that I'm having this kind of a situation. So yeah, that's when I started my TB treatment. I was sent to Murchison Hospital on the 16th of April. Then that's when I started the whole treatment.
When I recently started with the medication, one thing I did experience, it was I lost my hearing. Not exactly lost it, but it kind of got disturbed. Because like when a person is communicating with me, when if there was a background noise, I wouldn't hear them properly what they were saying until the background noise stopped first. Then I would hear them properly. Secondly, I had a rash all over my chest. But then I did report that matter, and Dr. Lachman, she gave me, she called the pharmacy and they gave me medication for the chest. When I drank the medication, some of the pills, they gave me depression. Not that I was thinking too much, not that I was stressed, but depression from nowhere, in such a way that I would like sometimes sleep down with my chest, because I could feel like this. I could feel it's pumping in here, the way I was so depressed. And those are the side effects that I did experience.
For the first few days, I had a bit of depressive episodes. There were times when I felt that I'm going to die. I'd rather just die now. I might as well just leave this treatment. I just had, like, in the mornings, I'd feel absolutely bad. And then, like, in the midday, then I would be fine. I'd be back to my normal, a happy self, because I'm actually a happy person. And then there was a nausea and a vomiting. Take my tablets, take food, then everything would come out. Some days I'll just wake up in the morning, everything would come out. Until now, there is days when I'm having vomiting, and some days I'm fine. So I'm not really sure which tablets are making me feel like that, but I'm still having problems with nausea and vomiting. With the hearing, I haven't experienced any side effects. The rash, I did have a bit of a rash, but then they managed to, like, that also subsided on its own. I didn't even take treatment for that.
At first, like for the very first dose of the treatment, I didn't feel anything. The only thing that felt better was that I was no longer taking that old treatment I was taking before I was diagnosed with MDR. So that was some sort of a relief that I'm no longer taking that River-4, which is giving me problems. But as I continued with the treatment, I started to have problems, like vomiting didn't really like stop completely, and also the joints, my joints would feel like so weak, like they couldn't work. The balance, I couldn't handle something with my hand. Sometimes I couldn't even stand on my 2 feet, but that usually happened when it's like very, very cold. Then once the conditions got warmer, I could go back to my normal condition. And the other one that I had was the hearing. They usually said to us, when you in kanamycin, the injection, you are likely to have our hearing affected, maybe become deaf at some stage, or you just use hearing aid or something. But for me, it was the opposite. It was very, very loud. I could hear sounds at a very loud volume. Even a person is talking with a normal volume, it would feel like this person is like shouting at me or something. So when I went to audio for checkup, they said no, it's the injection, but they monitored it. But as soon as I finished the injection, I stopped the injection, then eventually it went back to normal. So right now I don't have any problem with the hearing.
The support team was very brilliant. I mean, they were behind me like all the way, because even when I came there, the nurses were very supportive. They were on to me like 24/7. The service was good, everything was good. I kind of like make friends. I made friends in the hospital. I felt very welcome. I felt at home. That's why it was easy for me to take the medication, and that's why it was easy for me to recover, because I think in about 1 or 2 months already I was back on my normal weight. Yeah, so the support team was very supportive.
The staff at Murchison were very supportive because like I had a lot of fear, so with any questions I had, I knew that I had to phone Sister Kaya. When I went for, every time when I go for my review, then whatever queries I have, I just ask the doctor and he explains everything in detail. The staff at the MDR clinic, I also just phoned there, and even during admission, I was at the center hospital. They've taught us means of how to actually, with the side effects, how to manage the pain or caused by the injections. They taught us a whole lot of how to just get through the whole journey with the medication, how to take it. Like I had the problem of the nausea, so I was taking my whole tablets in one go, and then they actually told me the better options of how to do it, so that at least I can manage and be able to take the treatment without any vomiting.
The health care that you receive is very, very supportive. In my case, like when I was discharged, starting from the time when I was discharged, they always want to know how you're going to get your injections, where are you going to get your injections, and they want to monitor the way that you take your treatment. And if you're facing problems, let's say maybe like when we were in hospital, they would give us a certain schedule of taking treatment. Like in the morning you take this and that, during the day, in the afternoon, and in the evening. But when you get home, it's a different case, because no one is preparing your food. You've got different, like some of this medication makes you very, very drowsy, and you just wanted to go to sleep. Sometimes they would give us at hospital in the morning, because they knew we don't have anything to do during the day, so we did have time to sleep. But as I got home, I had to try to change that schedule so that it can fit my own schedule now that I'm home. So also they trained us that when you get home, it does not mean that you must stick to our own schedule. What is important is that you take all your medication, and you take it according to the way that is not going to cause any effect or any harm on yourself, or on your, it's not going to disturb the way you perform your daily activities. They have an outreach program for those who need to take injections, especially if you are in a place where the clinic is very far. So they would have arrange for people who come and give you injection at home. So all the time they would have that. So in my case, it was a different case, because the clinic was nearby, and there was also some nurse who was working in a nearby clinic who also volunteered to help. So all that also made it easy for us to go on with the treatment.
I'd like to tell people out there that MDR is just like any other disease. They mustn't be afraid. MDR is curable. There is treatment. You take treatment for MDR, and if you take your treatment good and you take care of yourself, MDR is curable. They mustn't be scared. It's just like any other disease. You just have to be yourself. And another thing, in order to treat MDR, you need to find out more about the disease. Don't just say I've got MDR and that's all. You must do research to know exactly what you're dealing with. You must find support. You must find counseling, all the kind of help you can get. So MDR is just like any other disease, and to the people out there, if I can do it, then they can do it.
The treatment is bad, it's tough, but you get through it. You just take it one day at a time. Some days are better than others. you just go through it one day at a time, and eventually you look back and you see that I've made so many months, and then you look forward and see that you can still do more months. But hey, if it would have for future people to have this treatment changed somehow, that injection is just too painful. If they can just change it, make it a better injection. And also ethambutol is the ugliest tasting tablet. Even after you've swallowed it, the taste just stays there on the tongue. If there can be changes like that, I think more people would adhere. I've had those difficulties with the treatment, but I've known that, okay, because it's important for my health, let me just continue, but it's not the nice medication.
If there was something that could be done about the treatment, maybe like try to reduce the number of tablets that I use, maybe put them together, or like something, put them into, maybe just, since that's the problem about it, is just that there are too many tablets. Maybe like have two, maybe all these ingredients, so to say, put together in one tablet and another one, then maybe work together. Maybe that can simplify it. And also the availability of the treatment. If it is possible for them to make it available in maybe in cases like clinics. But maybe, let's say the person will be hospitalized the 2 months, then they say, now that you've been discharged, you can get your medication from the clinic or something. Because for some people, I've seen others coming from like Durban, going to Murchison. That is like an hour and a half, depends on where. Yes. Then the amount that you spend, they spend around about 120. And some of them, they're not even working. So there are so many clinics they pass by, but they have to go there to collect their medication. So this has been a good experience for me, I must say. Yes.
To the healthcare workers working in TB, both in South Africa and globally, we at the MDR-TB Partnership thank you for your dedication and for your support. To the patients that you've seen today on this video, from the bottom of our hearts, we thank you for sharing your stories of success. We thank you for sharing your passion for MDR-TB and for educating others. And we really, truly appreciate your willingness to communicate this message to others. Thank you.